Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Dr. Shahiryar Ghazanfer and I am a professor of surgery at Daw University of Health Sciences, Karachi, Pakistan. Today I will be talking about the different ERCP scopes with special focus on the safety concerns raised by the FDA regarding the scope decontamination and transmission of infections. Now, duodenoscope plays a vital role in the assessment and treatment of pancreaticobiliary diseases. Now, because of their complex design and reusable, hard to clean components, there is a concern about the tissue or fluid transfer from one patient to another. And this can lead to transmission of disease in rare cases. Now, the main concern of the FDA is the fixed endocap that is present at the distal end of the duodenoscopes. And in the older versions, this endocap was glued to the metal surface, and this limits this actually limits the accessibility to clean the device, and especially the crevices at the distal end of the duodenoscopes. The best solution for this and the recommendations by the FDA is through innovative designs that incorporates disposable components. Now, this could be in the form of completely disposable scopes or disposable distal components that facilitates or eliminates the need for reprocessing. Now, to date, FDA has cleared 6 duodenoscopes with disposable components. Now, the one of the scopes is from a German technology. It's an EMBO innovation, a scope by the name of A-scope duodeno. This is a fully disposable duodenoscope, and the advantage, of course, is that you use it in one patient, and when the procedure finishes, you dispose of the scope, and there it eliminates the need for reprocessing the scope for disinfection process. And this is one of the best way to deal with this. The other is the scope by the Boston Scientific by the name of Exalt Model D, and it is also a single-use duodenoscope, which has the advantages over the other scopes, which have disposable components. Now, the scope by the Fujifilm by the model of ED580 has a disposable endocap. Now, by using these disposable endocaps, you can use these scopes, you can use these endocaps in one patient, dispose them, and use a new cap for the other patient. The scope by the Olympus, the newer model is the TGF Q190V, and this also has a disposable endocap. Now, the Pentax has 2 models. One of the model has a disposable endocap, and the other model is even better, which has a disposable elevator duodenoscope. Now, removing the elevator can also help. The whole assembly is removed and disposed, and you put in a new assembly each time you put the scope in a patient. In the end, I would like to focus that we should look at our own endoscopy departments and see what we can do to better able to treat patients and to prevent transmission of infections through these duodenoscopes. And we should think of changing the scopes. If we have the old scopes with the glued endocaps, then we should think ahead, try to change them with the scopes that have disposable endocaps. And of course, the best solution would be to have a disposable endoscope, use it in one patient, and then dispose it, and then use a new scope for another patient. I think this is what the future holds. I think this is where the future is. Thank you very much.